Dr. Jaffe, can the C cleanse protocol be recommended to patients who have chronic diarrhea?
Very important question. If someone has chronic diarrhea, what does that mean? Or if they have alternating diarrhea and constipation, what does that mean? And what does that mean in regard to the C cleanse? Let me start with the fact that the result of the C cleanse, what some people call the flush, is so different from diarrhea that people can easily tell the difference between reaching their C cleanse amount and even their chronic loose stool and diarrhea. Usually when people have loose stool, it's for only a few reasons, one of which is they're eating a highly processed diet, and from time to time they've had medicines like antibiotics or maybe proton pump inhibitors or other medicines, anti-something medicines that have a consequence for the digestive tract, and usually not a healthy consequence. So if we start with someone with diarrhea, they can do the C cleanse, absolutely. And many have found that it reduces or maybe even eliminates the diarrhea, because the diarrhea itself is a shedding phenomenon because the body is irritated by something and trying to get rid of it. Now, maybe it's trying to get rid of the processed chemicals in the food people are eating. We'll look at that and we can attend to that. And so when someone comes and says, I have diarrhea or alternating diarrhea and constipation, can I do the C cleanse? The answer is absolutely yes. Then we urge prebiotics, probiotics, and symbiotics in anyone that has digestive issues. If you're an American in the 21st century, the chances are your digestion is not up to par, and we want to get it above par. Now, if you don't play golf, you may not know what par is, but par is the goal. Par is enough. The goal is not to be perfect. Perfection is not necessary. But nurture yourself, your digestive tract, with prebiotic fiber, probiotic organisms, multiple strains that are alive, and most importantly, the novel symbiotic, the recycled glutamine with PAC, pyridoxal alpha ketoglutarate for you who are biochemists. The combination of prebiotics, probiotics, and symbiotics is essential for anyone with digestive issues, especially people with diarrhea. And then we suggest checking your digestive transit time. You'd be surprised that people with diarrhea often have a long digestive transit time. Seems counterintuitive, but it's why we do the digestive transit time as a self-assessment. And beyond that, when you have chronic digestive issues, the chances are the nutrients that you are consuming are not being assimilated efficiently. We call that bioavailability. The bioavailability goes down when there's anything that irritates or functionally shortens your digestive tract. Your digestive tract should actually, if you laid it out flat, it has so much, healthy digestive tract has so much irregularity that it would cover a whole tennis court. That's a lot of space. Well, a lot of people have a digestive tract because of atrophy and what we call enteropathy, that maybe a tiny fraction of that is their uptake system. So in many cases, we need to rehabilitate, restore, and renew digestive competence, and with that, many benefits, starting with the C cleanse.